So hello everybody and welcome to this Physichat podcast. Today we're joined by Ian Gatt. He's the head of performance at GB Boxing and also lead physiotherapist and also physiotherapist with AJ Boxing. So Ian, thanks very much for joining us on this session.
Hi Dominic, thanks for the invite.
No worries. And just to get straight into things, Ian, for people who don't know who you are and what you do, just sum up very briefly about a little bit about yourself.
I've been a physio now for 20 years and counting. I've been a sports physio really for 20 years too. I know there's always this thing about titles. It's not titles really. I think I predominantly worked with athletes over these last 2 decades, and I'd say in this last decade plus it's been predominantly boxing. I'm employed by the English Institute of Sport, which is the EIS, which looks after pretty much all the Olympic and Paralympic athletes in this country in the UK. And part with the EIS, I'm also what is classed as a technical consultant around the upper limb, specifically around the hands, wrists and elbows, which is sort of an area which I focus quite a bit. And where it comes even to assisting colleagues or even helping where it comes to sort of teaching generally, which is one of the other things I tend to do. But yeah, I mean, definitely a big passion around physiotherapy, particularly around sports.
So, I mean, you mentioned hand, wrist and elbow. So for anybody that knows you, you're the hand, wrist and elbow guy. Why did that appeal to you so much?
Yeah, I mean, it's not something I probably taught in the beginning of my career, and it's the same thing I tell to a lot of young practitioners, whether they're physios, whether they're sports therapists, sports rehab, it doesn't matter really. I think it's good to have a notion of, you know, you'd like to work in combat sports or you'd like to work more with a particular joint, but I started quite broad-based, and then I ended up in boxing now 11 years ago. The hands and wrists were and still are the bread and butter of injuries in boxing. And because of that, I recognized I had a gap in knowledge. But even more, I recognized that there was a wider gap in knowledge in the wider, I'd say, world of not just sports, generally around hands and wrists. So I probably spent the first 5 years learning myself and putting things together, and now I've probably spent the last 5 years teaching people what I have learned. And the more I try and teach, the more I feel like I'm the student, because, you know, like anything else, as you probably know, whether it's research or whether it's tales from the field, you keep on learning. So it's an ever evolving element, but it's an area which fascinates me.
I like the word evolution. It's just everything's always evolving, everything's always moving on. I mean, I'm actually interested, like, how did you even get involved with GB Boxing? Because obviously there's loads of people out there that want to be involved with sports and that kind of thing. So how did that even come about?
Sometimes it's all about, you know, a bit of timing, a bit of chance, a bit of what you bring to the table. So before GB Boxing, I was employed still by the IS, but I was full-time with GB Volleyball. I did 2 years with them. Those were good years, 2017, 2018. Wrong dates. That was 2007, 2008.
I was going to say that was a bit recent.
Yeah, it's a bit too recent. Yeah, I was thinking that was as soon as I said it. Now, 2007, 2008. So that was, you know, when GB Volleyball and other team sports got funding and almost got a wild card to perform in the London Olympics. But you know, we had boxing, which was based over here in Sheffield, where I am at the IS in Sheffield, and they were looking for a head physio around 2009. They spoke to me, they asked me whether I would be interested. You know, it seemed that the work I had done those 2 years with volleyball had shown and made its course. So they asked me, you know, whether I would apply. So I said, yes, I'll put my name in the hat. And when we think about it, boxing probably wasn't what boxing is now. It's in the beginning. It's in a concept. We had, you know, Rob McCracken probably came he was working as a contractor, in fact, as a coach initially, and he probably joined as a PD towards the end of 2009. So I probably started working before he sort of got fully involved. But the nice thing is, we started with a handful of coaches, a handful of support staff at the time, and I never thought, I was going to be on this journey with boxing and learn to love the sport so much. Like probably a lot of people sometimes, you look at different sports when you're young in your career. I didn't have a personal preference, but I liked rugby, I liked football, I liked Olympic sports, so I had quite a wide base. But the love and affinity I've developed for boxing in the last decade is immense. So now I'm absolutely biased with boxing, whether it is from the physio injury point of view or the actual art of what the sport is. I'm absolutely biased now.
I mean, it's actually interesting you call it an art, because I mean, I'll hold my hands up. I'm not amazing. I'm not very as well versed with boxing. You just turn on pay-per-view, you kind of watch it for the atmosphere, but you don't really understand what's going on. I mean, boxing is, over the last 10 years, has grown on leaps and bounds. I mean, now you're head of performance, so you've kind of gone up with that. I mean, as part of that team, have you seen like massive changes from the medical department as well as the quality of the athletes? Have you seen loads of changes, obviously, hopefully for the best as well?
Oh, definitely. I mean, one of the biggest changes is the inclusion of the female boxers, which started in 2012. So obviously, female boxers joined the program in 2010, and we had obviously the likes of Nicole Adams, who went on to win double gold medals. Obviously, she did the Rio cycle. We had Natasha Jonas, Savannah Marshall. So I'd say those were probably your pioneers in the sports. Amalda Coulson, I'll mention her also because she's obviously a coach now, also working with England. But one of the things we've seen is how more inclusion of females in boxing, what it means from an injury point of view. There's a lot around, a word that's possibly is taboo with some people, but shouldn't be anymore. Periods, menstrual cycles, and the fact that we still don't know a lot in the general community. We're still learning. We're tracking those things. We're looking at, energy deficiencies, and again, not just in the females. I'd say because there's a misconception sometimes it's with the males. So from my end, because the team has grown, I've got more doctors involved, more physiologists, got the nutritionists, the physios, the SNCs. As a team, we're always looking at what are we doing collectively to monitor our athletes. Wellness is a big thing, tracking our athletes day in, day out, just to see levels of fatigue, of mood, of motivation. What as the components there that could probably relate to injuries. And, I probably sit here saying we still don't have the answer. We're still learning. There's a lot of things I probably know more anecdotally from the years being than we have from the data coming through, because we know injury is so multifactorial that it's a hard thing sometimes to just put one finger on one thing. But we definitely have learned a lot. We've learned, which injuries are predominantly with the males versus the female. What are the risks that can be attributed to that? What are the things we can do when injuries happen? Timings of scans. Do you scan? Do you don't scan? But the main thing for me is we have a fantastic team. We collaborate really well together. And it's nice that, there's that sort of, even when there are debates, there's a bit of the same mentality. We're all trying to pull in the same direction.
Yeah. I mean, one of the things that I want to sort of go into is because I know you've worked with these athletes now, and I think the most sort of when they come in at the start of their amateur sort of boxing, and then you've seen so many boxers then go on to greatness, and I think the most obvious one is AJ, and going through that. I mean, what's it like for you seeing the transition of these athletes? But I also want to find out as well is there a real difference with how you treat and manage these athletes in compared to a Joe Public? So Joe Public has a hand, wrist, elbow problem. Is there any difference in the way you manage them?
Yeah. So, when the boxers come through our ranks, I think the most important thing for me is education, is how to you educate a boxer to become self-sufficient? Because I know there's this big debate, you know, hands-on, hands-off. I'm one of those that I work depending on the person in front of me. I'm judicious, but one of the things that I've learned is that when somebody walks through the door, whether they are a boxer joining on the program, whether there is a Joe Block, as you mentioned, most of the times the perception is that they are going to get on a physio table and you're going to treat them hands-on, and that sprinkling the magic dust, they're going to get better. Now, the reality is that that's not the case. And
no magic dust, no.
No magic dust. And the only thing I can say is that, in fact, one of the most important things we discuss, I'd say, as a physio team, if I use just the physio team within boxing, is if somebody's getting hands-on, we discuss the justification of that in relation to the wider rehab stroke strength and conditioning approach. And even if they are, say, more of a dependency type character, how are we going to weave them off? The reason being is we know that a lot of the literature and the research does indicate that exercise and rehabilitation are the base, the strength of most of the conditions. The other thing, however, we need to remember is that our athletes, on a day in, day out, they are already doing a lot of rehab, if you want to call it this way. So rehab in the form of prehabilitation and rehab in the form of integrated with strength and conditioning. So when an athlete sees us, there is a very good justification for us to do hands-on. Why? Because we're already doing everything else.
Yeah.
So if somebody told me like, oh, you know, we've noticed that most of the things you are doing are hands-on, I'll say you're right, because the other things are catered for already.
Yeah.
And don't get me wrong, we will tweak our approaches. We'll discuss with the S&C based on whether the injuries are chronic, recurrent, acute, subacute, the area, the mechanism, you know, the type of athlete, the gender, you know, we could keep on going forever. So many factors.
Yeah.
When somebody sees me, Joe Public, to use that, again, I need to, first of all, understand, are they an athlete? You know, maybe they're not the athlete, but they're a sub-elite athlete. Are they the weekend warrior? Are they the non-athlete? Are they young? Are they old? Mm-hmm. So obviously age plays a big element. You know, was the chronicity of this injury and the probably nature or type of injury. So there's all those things that go into play. But my approach towards them isn't going to be different than seeing a top elite athlete. What I mean by that is my rationale is when they come through the door, the first thing I need to understand is what are they aiming towards? What is their objective? Now, it may not be a major tournament coming up, but it might be in 2 weeks' time they have a competition they want to go to. Yeah. Or their aim is they want to start doing an activity of daily living, which is something really big for them because it's impacting. It could be something as simple as if I can't do this, and in 6 months' time, my daughter is getting married. So I'd like this to be ready and be good in 6 months' time. So you can use those analogies. And the way I approach it is similar to my athletes. I don't start working from now forwards. I work where they would like to achieve and work backwards and try and see whether if I work forwards from now, does it cross over? And the next thing is understanding what is the evidence out there. You know, there's been a lot of research published. I'd say probably in the last 6 months, everybody's churning reviews and meta-analysis like, you know, there's no tomorrow.
Yeah.
Like, you know, the world is going to end by the end of this year. So let's churn out everything there is, which is great, but obviously it's hard to keep up. So you're all the time trying to keep up. But the good thing is there's a lot of studies in different joints for different conditions, for people of the ages of 40, 45 upwards, you're more adults, for your younger athletes. But then I always say that with all the information out there, you still have to filter it to the population you're seeing and the people you're seeing in front of me. Obviously, the one thing I need to respect also is the athletes that we see in GB, apart from the fact that there's a lot of pressure because they need to perform. We get a lot of pressure from the coaches, from the program to get them to where we have to. We can see these athletes day in, day out, any time of the day we want. So your approach to them is always going to be potentially slightly different to somebody who comes and sees you for a private consultation, pays X amount of money, maybe is traveling halfway down the country, and possibly won't be able to see you for the next 3 weeks, or the only way that they can see you, which is still positive, is online consultation, which again has its merits. But if somebody told me, example, hands and wrists, if I wanted to test strength, if I wanted to have a look intrinsically at certain things, I don't think that with the current technology that you can actually have a robot in the room and it does the job for you. So
that'll be the day, wouldn't it?
that would be the day. But don't get me wrong, there's lots of ways and there are certain technologies to help you. But the reality is the face-to-face and the online, both of them have a value. And I have, during the 6 months, I have had positive online from beginning to end in certain areas with certain people, especially because they can't see me face to face. With others, I've done the first consultation face to face, continued online. With others, it's been vice versa. With others, it's been full face to face. So as I said, I see a lot on Twitter, this black and white approach. It seems like we're in the age of Twitter polls, where people are putting 2 answers or 4 answers or 3. Usually they're yes or no's. I'd say you can't have that. It's good to have an idea and maybe be biased a little bit, but I'd like to have that open approach and say, okay, I might have a default. And maybe even I've learned in the last 6 months that this online technology is actually very useful and resourceful. Same as I've done with the teaching. I've gone more online because of the current situation. But you have to be open that you can't treat everybody stigmatically exactly the same. It's not going to happen. Yeah. But in short, to answer your question, I still use the same approach to treat non-athletes like athletes, because for me, the athlete isn't more important.
Yeah.
What's the most important thing is the person in front of me, and I want to make sure that I'm giving them 100% of me, of what I can do. And a simple example is if I measure hand strength in an athlete using a hand grip dynamometer, I'm going to do the same for a non-athlete.
Yeah.
The rationale might be different, the way I'm approaching might be different, but it's not going to change much more. Obviously, when I'm doing higher levels of testing, it is going to change, because an athlete has a different approach to somebody who their goal might be to be able to reach up and grab their jar of coffee. But equally, it's an important goal to achieve.
That's great. And I think it's, I want to go back to the hands-on, hands-off debate, because I see a massive value in getting hands-on with things, but then obviously, you have to back up things with the rehab aspects as well. Now, working at an English Institute of Sport, GB boxing, professional athletes, there will be, quite frankly, there will be a perception that you guys can get whatever you want and you can use whatever you want. I suppose 2-barrel question. 1, for your hands-on stuff, is there anything specific that you use? And 2, do you have essentially whatever you want whenever you want?
I'll probably start with the later answer, which is like, I'd like that. I'm still looking for Aladdin's lamp to rob the genie and ask him for whatever I want, but we don't get that, especially with the English Institute of Sports and GB Boxing is public funding, it's money paid by taxpayers' money, and we have to be very judicious how we use it. So we can't just go, yeah, I want this, I'm going to get it. What we do, however, is again look out what there is in the literature, see what there is, and also, me being very much, I'd say, hungry, trying to see what can work. I try and see how certain things can impact and fit in. I'm not one of those that goes, well, I'm going to wait for the literature to tell me whether it works or not, and then I'll try it. Because I'm going to be honest, for somebody to do that in my specific population, it's probably not going to happen unless I do it. Yeah. So a lot of times what I'll do is, if there's something which really interests me, or if somebody's brought the attention to me, I'll look into it. I'll see what it is. And the thing I've always done, especially if they are a serious organization that is trying to promote anything, whether it's any form of equipment, I'll say, could we have a trial period? so that we can see how it fits within our environment. We're comfortable using it. Will we use it, or will we just sit in the corner, getting dust? And will it have the effects we wanted? And I think this brings nicely to some of the things we've trialed over the years. I mean, I've used lots of things over the years, which I know, there's a lot of controversy around them. I've used acupuncture, and especially it's worked wonders, especially in acute scenarios. Will I use it in chronic situations? Personally not, and there might be those out there saying, thank God for that. There may be others saying, oh no, I use them and I find really good. Fantastic. Both of you have your own thing. I've used them really acutely in competition, in acute scenarios. I think in 2010, we even published a paper on volleyball for athletes, which saw a difference. But what I mean by that is I'll use it in the areas I feel really comfortable with and which makes a difference. Over the years, I've used things like ISTM, I've used negative pressure, whether it's using the cups and moving them around. No, I don't bruise people. I try not to infect. And no, I don't draw blood. And I don't believe in voodoo and evil spirits. So don't worry out there if actually you think that. In fact, I think that's a joke, personally.
I mean, on that, actually, because that's a big area, is that you see a lot of people cupping, doing the ISTM stuff. I mean, one of the questions is going to be about some philosophies and values that you have, which we'll get onto in a little bit. But when you see like the scraping stuff and when you see the cupping stuff, I know it's a controversial area, so whatever. Genuinely, what do you think about when you see that kind of thing?
For me, if you are trying to impact on function, and through some weird mechanisms, there are very people out there that are so intelligent that can tell you all the efferent and efferent and all the endorphins going on and everything. And sometimes I think like, yeah, that sounds really great in theory, but does it really reflect in real practice? But the reality is you are causing some form of uncomfortable reaction to somebody. You're getting them to move, and then when they go off the table, you can see, oh, that's feeling really well. I know there's another controversy, or people ask, well, there's no literature around that window of opportunity. Well, for me, it's true. Probably there isn't any research out there, but if somebody couldn't do this, and you've done ISTM, or you've done some form of negative pressure with somebody, and now they can do that, and you get them doing the exercise straight away, and they can still do that, and it carries over, fantastic. I know some will argue, well, why didn't you start doing the exercise straight away? You might have had a better result. From my experience, I'm not saying you won't, but it takes longer. And if I'm seeing Joe Block off the street who comes to see me, I agree. And I know that a lot of these philosophies fit a lot, particularly with the NHS, probably mixed with private practice. So obviously you'd give them something that, yes, might take a bit more time, but they will get the result probably still. But when you're working with an elite athlete, where the difference between training or not is 1 hour, you need to make a difference now. Otherwise, the coach will tell you, bugger off. You have to get your hands dirty. And by doing that, though, it doesn't mean that you're just doing a bullshit approach. What it means is you've seen differences, you've made a difference. It's the same thing as using taping, using K-tape. Lots of people out there say it's bullshit. You can use anything. I'll probably say you're probably right. But for the shoulders, I used to use rigid taping in the past. Then I discovered K-tape before it even hit the UK, because I used to use it, back in the days in Greece before it even hit the shores of the UK 20 years ago. And I found the athletes used to find it better because it was lighter, was less restrictive. And, again, I'm not going to go and saying, yeah, I believe it lifts the skin and everything, all these things. But when I've put it on athletes, they felt somehow it made it better, felt more comfortable, and they have a better approach. And so our athletes with shoulder injuries particularly, maintaining them in the acute stage, whether it's a bit of a buy-in or whatever you want to call it, it works well. I'm not one of those people, I'll do something just because it looks good. If an athlete tells me it's doing nothing, I'll take it off. Fuck it, we're not going to do it. But then equally, you need to think about what you're doing. So, what you don't want to do is do a robot. Well, I've done it for one shoulder. The next 100 shoulders that come in, I'm going to do exactly the same. And the reality is, I probably shift in, like 1 week I could be using ISTM a bit more. The next week I've forgotten where the tool is because of the other, you see what I mean? So
Yeah.
as I say with Shockwave, we've trialed Shockwave. We found it really good with a few athletes that we tried a lot of things with them. You could even say we've thrown the chicken sink at them, where it comes to rehabilitation and all the approaches and all the proprioception and all the eccentric things and all the fancy things that people will mention. Don't worry, we've done them. But we had 2 or 3 fantastic cases that literally that difference between them going from not really being available to being fully available was actually Shockwave. And, we had a fantastic response. Shockwave on ligaments. So don't worry. I know there are people out there thinking, oh, there's no evidence on tendons. The big gurus are telling them. Don't worry. I've not tried them on tendons. Maybe it works. I don't know. But I've actually used them on ligaments. 2 of them were at the knuckles. Yes, my boxers, and 1 of them at the elbow. I've actually we're trying to do like a little case series write-up and see if we can. But all I can say is, again, I know people out there will say, oh, here we go again, the n equals 1 and it's poor quality and everything. But in my world, it makes a big difference. Having certain tools that you don't use with the majority of your athletes, but can make a difference to possibly your gold medalist. So that n equals 1 could actually mean millions of investment into the program in the next cycle. That makes a big difference for us. So, looking for the magic bullet, that gold dust that I said before, it could be anything. And, it could be an exercise. True. It could be a particular tool. We've had some people respond fantastically to acupuncture. We have people that doesn't even touch them. So, I am one of those, yes, that's, shouts out saying you need to have a lot of tools in your repertoire. Equally, I'd say you have to be careful because, you don't want to learn too many things and then you never get to use them. So if you are working in a particular department and you're going to be stuck there for the next 20 years and all you can do is exercise, for example, and then if not, you can get them injected by a colleague who's a bit more senior than you, then fine, fair enough. It's useless learning all these things. But I'm lucky enough to have learned a lot of different and varied techniques over the years. I know that, and I agree with a lot of the research, that a lot of them will work in the short versus moderate term rather than the long term. And, I'm not going to hear, and again, I don't want to bullshit people and say, yeah, acupuncture, will solve all your labral tears and instabilities and your athletes will be 100%, after a few sessions. That's not the case. But you have to remember that a lot of athletes, particularly, say, for example, now, we're less than a year to the next games and even less to possibly our next qualifier next year. You get a lot of athletes who, if you had to scan them now, they probably have lots of baddies from a pathological point of view, not 100%. And you're doing all the rehab, great, but you have to do a little bit extra on them. And it's not to please them. It could be a little bit, placebo, nocebo, we talk about all that. But sometimes it makes them feel better. It makes them train better. It keeps them available. And ultimately, for me, if somebody had to ask me, with all your interventions, what is your aim? It's not to make them feel better. That's maybe the big difference sometimes that people approach it, is to make somebody feel better, is to make them be available for training. So, I don't expect any athlete to be 100% walking through those ropes as an athlete. You can't be. You're training at the highest level possible. If you are somebody who's not even an athlete and training 4 to 5 times a week in the gym, yourself, you're always going to pick up something here and there. So you're never 100%. But you being able to do the session, be available for the session, is a difference between you feeling good every time for the session. And so when an athlete comes and says, oh, it's a bit niggly, I'm not going to start treating them because it's a bit niggly. I will only consider whether that's going to impact on their availability in the short to long term. And that's a different way of people thinking, oh, yeah, you guys probably just mollycoddle them, put them on the couch, start massaging them and all those things. In fact, just to help people also, I was asked whether we need a soft tissue therapist in the London cycle, and I refused that because I wanted more physio time. Now, I didn't want more physio time because I wanted them to do the soft tissue, but basically I wanted a practitioner that can be judicious in the way they're approaching their rehabilitation, in the way they're approaching their hands-on, and decide between the difference. If anything, I don't mind them getting soft tissue, and usually what a lot of our athletes do is they probably get it on a weekend with somebody back at home, which is fine. Again, there's no evidence it helps recovery, but if it makes them feel good, that's fantastic. That's great.
I mean, on the equipment side of things, I mean, you mentioned Shockwave. Then I'll be clear. Obviously, we've worked together for a few years now with some of the equipment that we work with. So the Shockwave, just for everybody's clear, that was a focused Shockwave system, wasn't it? Not radial.
Yeah, it's interesting you mentioned that because I first trialed. So I always had this niggly thing about Shockwave, thinking that because one of the things I've learned in my career is that frequency can impact a lot on pain. So, whether it's using the frequency of vibration platforms, whether it's the frequency of exercises, like hitting a bar, for example, against a tire, whether it's the frequency of using bands or the ISTM, So I always had this thing in my head thinking frequency can impact on pain inhibition or desensitization. So I never thought about Shockwave of, oh, it's going to heal them and take away inflammation, whatever. And to a certain degree, I'm not bothered too much. I know, we could go down that route, and I know it will probably, again, we're going to get the debate. But it's interesting you mentioned that, because when I trialed radial, and I trialed it on myself and a few people initially, it was too painful on normal knuckles. And I said, there's no way my boxers are going to tolerate this, especially because the last thing they want is me inducing pain on them. Right. When the focal came out, and I've used the piezo wave, which is easy as anything to use, by the way, and you don't need to be a rocket scientist to use. I trialed that, and I trialed it on myself, and I thought, you know what, this is brilliant. This feels really good. Now, I don't know whether it's going to work or not, but I tried it on a couple of stubborn knuckles, chronic knuckles, that we tried lots of things. We got lots of consultations. We tried the ISCMs. We've tried everything in the book, acupuncture, whatever it is, the rehab, the eccentrics, the isometrics, the whatever. So, even for the non-hands-on people, don't worry, we've tried it all, I don't know what I was short of, just spreading ice cream on their hand to make them believe it makes better, or magic ointments. I think the next thing will be CBD, because it seems to be people are believing CBD. But what I was getting to, I always am a believer that, if you provoke more pain than they actually have, and it is induced, and it is a controllable pain, then you might sometimes get some form of override, reboot, whatever. And again, I'm not going to go into dark art of pain science, because I know, again, some people out there might ridicule me, and you'll probably be right, but I've seen it in practice. And some people might respond different to others, and that's a reality. But what I found is with these two stubborn knuckles, it worked brilliantly. And one particular boxer, which, we're starting to get worried, she even had got injected a couple of times, say what it is. She's now in full training. She's been to a training camp overseas recently. Absolutely, we don't even record the knuckle anymore because it's gone. 10 sessions of Shockwave was amazing. Now, we've got a squad of 45 boxers. So, if you take the percentages, it's a very short percentage. And fairly so, if somebody's working private practice, they may think like, yeah, well, I'm not sure, whatever, X, Y, Z. But it has its uses. And I think like anything else, you have to be ready to put it in the framework. So equally, as I said, we had somebody with a nasty elbow. It was a grade 2 injury of the elbow, UCL injury. we did lots of things and everything got better to the point it got to, and we did, for a person, I think, a very good rehab approach. It was, still a bit niggly, like, good days, bad days, that sort of thing. And by adding this, it was good. The best thing for me is our boxers, again, a bit like me, hopefully. Maybe I'm actually more bullshitter than they are. They don't bullshit. What I mean by that is they'll tell you whether it is good or bad. And
Right.
nobody will tell you, do this if it's painful. But very interestingly, these athletes told us, can we get this? Can we get this?
Wow. Okay.
They were eager for getting it. And what we were doing, in fact, we did, contrary to what some people believe, we actually did it 3 times a week, Tuesday, Wednesday, Thursday, whilst they were in full training. So, and hopefully, if we do manage to get this paper through, we'll have all the settings and everything, which might help certain people. But contrary to some people thinking, oh, you do it once a week only, or you have a big break, can induce injuries or whatever. We actually did it 3 times a day for probably 9 to 10 sessions. And
Wow.
we had a great result. Now,
Okay.
I know it can be an expensive piece of equipment, but it can make the difference between somebody, an elite boxer, for example, being there and not. And don't get me wrong, I think it has its use in other conditions, but because of lockdown and everything, again, we've probably not had the time to play around with it as much as we wanted. And hopefully in the long term, we'll be able to sort of evidence more that it has its uses.
I mean, it's brilliant that you're getting those kind of results. And I think one of the last things actually I wanted to cover before we sort of wrap this up is one of the things that we do at Physichat when we're looking at new equipment, new technologies that are available. We have like three areas that we look at. We look at the clinical evidence and the research, what's in the black and white. I mean, shockwave, it's a discussion for another day, because I think the majority of shockwave papers you can throw out the window.
You'd be shot down, mate.
Yeah, honestly, I've read hundreds of papers now, and you just think some of these are crap. But I'm not a researcher, so it's a bit risky for me. Anyway, so we look at the clinical evidence and the research. Is it their clinical efficacy? Can it be used? Then we actually take the systems on trial. So people that don't know me, I do sport exercise therapy. So I see my own patients. So I'll try it with those patients and get my own clinical experience. And then we get the patient feedback, or for you, the athlete feedback. And I want to sit right in the middle, getting a little bit from everything. Do you have a similar approach to that? Because you must get approached by every Tom, Dick and Harry when it comes to equipment. I'm not going to name particular equipment, but you must get approached by everything. Great things, and then equally some not so great things. I want to use another word, but equally not so great things. How do you decipher what you're going to trial? Because obviously you said, we trial things before we commit to anything. But how do you decipher actually what you're going to trial? Because your time's precious, isn't it? So you're not going to take stuff on that you think is not going to make any effect. So what's your kind of briefly, what's your process before you look at anything really?
Yeah, so the first thing is, when somebody approaches me with something, is it something which is, in people's tongues? This is a common knowledge. It's something which a lot of people are using, and so it's going to catch my attention. The second thing is what is the research behind it? Is there any evidence? And you have to remember, when things are new on the market, for the research to have caught up, probably there isn't. Although I would want to hope to a certain degree, if there's a certain level of patency, and it depends on the type of equipment, that there maybe is. But then the other things I'll go into is, what is the usability? So, is this something that's going to be easily used by the masses, or is going to be easily used just by the one person? What is the cost effectiveness of it, basically? Is it going to be very expensive for just one person? Is it going to be cheap for the many people? And so you play around with those things. And so over the years, it's a bit like foam rollers. Again, people are attacking foam rollers mainly because people rate that foam rollers do X. And, it's like, what? It's a great piece of tool for self-management that people can take away with them. And if it makes a difference, then let them use it. If it impacts on their pain and their function, let's not become a bit too scientific, bog-minded, thinking, but what does it actually do to the connective tissue? And does it stretch it? Does it compress it? Okay, some people maybe have bold claims, you know, like, yeah, if you do it on the TFL, it's going to loosen the TFL. And, you know, obviously then you're going to get somebody on the other side saying, have you ever seen a TFL from a cadaver? There's no way you're going to loosen it, not even if you nuke it, which they're right. But if you actually do put on like a foam roller, for example. And again, I go back to vibration. I like the vibrating foam rollers. Why? Because I believe that it has that activity, and actually you need to move less on it. You cause less discomfort, less pain, and then it does something. And equally, I go back to what I said before. Now, I don't want people to think I'm some form of sadist, but in my career, I've seen that, probably some people do think that, but when you cause a certain degree of discomfort, which is controllable. I'm not saying like you got people crying off the beds, you know, like don't go down that route. But you can get them to a point of certain controllable. Sometimes you see massive results, you know, and I've seen it from the athletic population, and I see it as a carryover in the non-athletic. But then equally, what I'd say is, going back to one of your questions before, I would work differently whether I'm working with somebody who I want to achieve something now, today, acutely, because they have to compete. So I'd probably, excuse it, hurt them a little bit more to get a quicker result so that they can be more functional immediately, versus somebody who, one, probably they have an underlying history of some heart disease and you don't want them to pass out as you're doing something. But equally, you know, they've come to see you with something and maybe it's been there 6 to 9 months, if not more, or maybe it's acute, it doesn't matter. Why trying to do something immediately for them to walk out? So again, you have to think about those approaches. But no, when people approach me, I have to measure it up. I also have to measure how it's going to fit with our population, how it's going to fit if, again, I'm lucky because I've got another 3 full-time physios that the first thing I'll do is ask them, you know, what do you think about this? Should we trial it? Should we see how it goes? And we try and go with that approach, and then we try and get the feedback. But yeah, I mean, time is one of the big ones. Time, cost, effort in using things. And so, you know, I probably have to say I'm sorry if I disappoint a lot of people out there. Mainly is because I get too many requests, and probably I got a lot of requests in lockdown when we weren't even doing any hands-on whatsoever. It's just like, I can't even do this. Sorry, you know, wrong timing. You know, let's try it maybe next year. In the meantime, we'll hear a bit more. But you know, if I go back to the shockwave, probably by the time I probably wanted it, let me use that in my head. Well, I wanted to trial it, to actually the time I got to trial it, as we said, it went from the radial to focal, so there was a beta machine. So it means I was actually not too biased by the time, and time had passed. And I formulated a few ideas in my head, but I'm never biased. I never go like, I believe this is going to work. And I tell the athlete, you believe is going to work. Because I know some people out there think like, well, if you really believe and you make them to believe, then it will work. I'd like that to work. Sometimes maybe it is, but it doesn't really work in my athletic population, because if they hit with their 4,000 to 5,000 newtons of forces against somebody's face, trust me, if it's painful, it's painful. It's not going to be not painful just to please me.
Well, I think we've covered quite a lot of stuff there. And I know, speaking about time, I know your time is precious, and I know you're probably in demand right about now. So all we'll do is wrap this up for now. But thank you so much for your time and sharing what you do at GB Boxing, some of your philosophies and things as well. Do you have any upcoming courses or anything that you'd like to let anybody know about?
Yeah, so as I said, obviously my special interest is the upper limb. So I'll either look specifically just at the hands and wrist, or sometimes we look at the upper limb complete. So hands, wrist, elbows, and shoulders together. Upcoming courses, I have some signed up with a company called Anchor. End of November, we're actually doing an online hands and wrist, where people who sign up will have a lot of pre-recorded material, which I did over the last couple of months lockdowns. Obviously, we've been with recent research updates, and then we have a live event, and then face to face, because even I'm conscious about the current situation.
Yeah.
There's a lot being booked between January and March. Hopefully that'll happen. I do hope that we're in a good position to do that. In the meantime, follow me on Instagram and Twitter if you want. You find me under Ian Gatt, Gatman usually, which is the nickname that I've had for more than 10 years now, probably 15 and counting, especially with the athletes. So most of them know me as the Gatman. But again, I'm one of those that will comment on certain things, not try and be controversial, actually try and maybe come from my point of reasoning, working with athletes and non-athletes, but also where I promote a lot of my stuff around teaching, but equally what's happening in the sporting world, from boxing to other things, traveling away. And obviously, you probably know, we've got AJ coming up soon, hopefully at the end of the year, and then hopefully next year we'll have the Olympics. So lots of big things coming on over the next 12 months.
Busy times. Well, yeah, we'll pop your social media details in the comments of for the podcast, and if anybody's interested, we'll get a couple of the links for for any of your upcoming courses that people might be interested in as well. But otherwise, I'll let you go because I'm sure you've got a million things to do. Ian, thank you so much for your time, and all the best with everything going on with GB Boxing as well.
Thank you, Dominic, and you and everybody. Stay well, keep well.
Perfect. Cheers.